Welcome to Channel 32 News. I'm Dylan Scheid. A recent case of neurofibromatosis has broken out of the local middle school, Farview Valley Middle School. Neurofibromatosis is a genetic disorder that disturbs cell growth in the nervous system, which causes tumors to form on the end of nerve tissue. NF1, also known as neurofibromatosis type 1, causes skin changes and deformed bones and usually starts at birth. It is the most common form of neurofibromatosis. NF2 causes hearing loss, ringing in the ears, and poor balance. It usually starts in the teen years. Schwannomatosis causes intense pain. It is the rarest form of neurofibromatosis. The gene for NF1 is located on the 17th chromosome, and the gene for NF2 is located on the 22nd chromosome. Now I'll pass it off to our field reporter, Jerry Bacon.
I'm Jerry Rigdon here at Farview Valley Middle School with our study on neurofibromatosis. Tumors in neurofibromatosis are able to form anywhere in the nervous system, such as your brain, spinal cord, or nerves. This disease is usually developed in early childhood or early adulthood. Usually these tumors aren't benign, but in their worst case they are deadly. People with neurofibromatosis usually suffer mild symptoms. In NF1, there are many common traits to show that someone may have it. These signs are presence of 2 or more pea-sized bumps called neurofibromas on the skin, or 1 or more large areas of skin that look swollen, or freckling under the arm area or groin. Most people with NF1 have large brown spots and large lumps of skin where the tumors are. A lot of possible landing spots for NF1 or NF2 tumors are the skin, spinal cord, brain, or nerves. NF1 is much more common than NF2, and the tumors will land on the cranial and spinal nerves, and those kids may have hearing loss. If kids have those symptoms at the age of 15 to 22, then more times than not they have NF2. NF1 is an autosomal trait that's dominant in people, which means it's located on one of the 22 autosome chromosomes. People born with this case have at least 1 mutated gene. This disease is like none others. This disease needs 2 altered forms of the disease in order for the hazardous tumors to begin to form. NF affects men and women of all races and ethnicities. It makes it one of the most common hereditary diseases in the world. NF1 is usually diagnosed when you're a child, and NF2 usually diagnosed when you're a teen or young adult. If a person has it, the child has a 50% chance of getting the disease. Neurofibromatosis tends to decrease life expectancy by 15 years. NF1 occurs in 1 to 3,000 people nationwide, and NF2 occurs in 1 to 40,000 people nationwide. Most people with NF1 live relatively long and healthy lives, but it does reduce life expectancy by around 15 years. Now I'm going to show you a picture of an example Punnett square with pretty good chances of getting NF. Also, I'm going to show you an example pedigree showing the history and an example family. Now back to Micah in the studio. Also, I'm going to show you an example pedigree showing the history and an example family. Now back to Micah in the studio.
Thank you, Jared. There are many ways to diagnose NF1. Parental testing is when they look for the existence of NF1 in the fetus. Because if embryos were produced with this disorder, there is a chance it would be passed down to the offspring. Postnatal testing. These are practically looking for physical traits that appear on the skin or in tumors which involve freckles and pigmentation in the skin. Radiologic features. This is mainly looking at internal symptoms, usually that have to do with limbs and major parts of the body affected by radiation. The following organs are affected: the brain, spinal cord, nerves, and skin. The brain tends to be affected with symptoms such as ADHD, and the spinal cord is affected by the improper function of nerves. The skin is affected by odd pigmentation and formation of freckles. I am now going to list the symptoms and treatment options for NF1. Symptoms include ADHD. Treatment options for ADHD are medications and behavioral therapy, bony lesions, which is the next symptom, and then treatment options are bracing, observation, and surgery. Next symptom is brain tumors, and treatment options are observation, surgery, and drug therapy that is currently under clinical investigation. Dermal neurofibromas, which is the next symptom, and the next treatment option for those are observation, surgery, and drug therapy that is also under clinical investigation. Next symptom is learning disabilities, and treatment options are IEP or learning programs for special need.
I'm here at Paul Creek Valley Middle School with Nathaniel Anko, who has neurofibromatosis. So Nathaniel, what is it like to live with neurofibromatosis?
I have pain anywhere where my nerves are, and that's where the tumors are growing. I become tired very easily. My body stops me from doing things that I want to do, and I have to have regular checkups with the doctors because they recommend that. Finally, it's sometimes I'm unhappy for no apparent reason. For the treatment for NF1, the doctors have not found a way to really get rid of it, but they can prevent it from growing. They recommend surgery to remove the tumors that may be cancerous. Surgery, radiation, and/or chemotherapy may also be used to control or reduce the size of optical glioma, nerve gliomas, when the vision is being threatened. Treatments for other conditions associated with NF1 are aimed at controlling or relieving symptoms. These include headaches and seizures, which can be treated with medications. The transmission for neurofibromatosis is inherited. Both types of neurofibromatosis are autosomal dominant genetic disorders, which means an affected person has one chance in two of passing it on with each pregnancy. The cause of neurofibromatosis also can be the result of spontaneous mutation in the genetic material of the cause for NF1 also can be the result of spontaneous mutation in the genetic material of the sperm or egg in families with no previous history of NF. About half of these cases are inherited, and the other half are due to mutations in genetic material. And the NF1 gene is located on the 17th chromosome. In-depth and explanation. The tumors called neurofibromas are usually benign and grown nerves within the body, as well as under the skin. The tumors can cause skin changes, bone deformalities. Example is bowing of the legs or thinning of the shin bone, and other problems.
Thank you, Nathaniel. That wraps up our show tonight. We leave you with a picture of Nick Gilbert, the Cavaliers owner, who has neurofibromatosis. See you tomorrow.